everyone. Welcome to our May Ask the Expert interview. Today, I'm pleased to have Dr. McKune from the 7 County Services with me today to discuss all things mental health. May is Mental Health Awareness Month, as you can see on her background, and we are just excited to have her on to talk about the services that they provide for this much needed area of healthcare. So thank you, Dr. McKune, for being on with me today.
Well, thank you, Jennifer, for having me.
Thank you. First, can you just kind of dive in and tell us a little bit about the mental health services that you provide there at 7 County Services?
Sure. So 7 County Services is the community mental health center for Jefferson County, where Louisville's located, as well as the 6 surrounding counties. So that includes Shelby, Spencer, Henry, Oldham, Trimble, and Bullitt, as well as Jefferson.
What specific types of services do you all provide regarding mental health, and how can people access those?
Right. We have the full continuum of outpatient services for individuals who have mental health or substance use disorders. So that includes everything from individual therapy, family therapy, group therapy, to more intensive services such as IOP, so intensive outpatient services. We also have some residential services for children in crisis. We have a crisis stabilization unit for children and youth. We also have a residential substance use disorder treatment program for individuals needing more intensive substance use disorder services, and that includes up to detox. So someone could come in that had recently used substances and needed medical oversight while they detoxed. So we have detox services. We also have psychiatric services and some of the services to help individuals in the community, such as case management or day treatment programs. So a variety of services up to hospitalization. We don't do hospitalization.
And so how does someone typically get involved or get to receive your services? I assume there's a referral process.
Yes, there's really no wrong door for individuals to get into services. So we frequently get self-referrals from individuals who feel like they would like to reach out and talk with someone. Sometimes we have friends or family members, sometimes providers reach out. Probably the easiest way to access services would be to call our access line, and that would get you connected to whatever service you might be seeking. And that number is 502-589-1100. And when you call that number, they're going to ask what type of services you're looking for, and they will connect you to that direct departmental area so that we can get you scheduled to come on in. We also work very closely in the community with the 988 service line. So I think for individuals who hadn't heard of 988, that's similar to 911 for people who are having behavioral health crises or who may be wanting to talk with someone and aren't sure where to go. We provide the staff for this region and answer the call, and we can then help get you connected to whatever service you might need.
So you mentioned that you all cover Jefferson County and the surrounding counties. Can someone that is from outside of that area, let's say they're in Perry County or somewhere outside of those 7 counties, can they access any services? Or if someone is outside, kind of what do you recommend?
We do have some telehealth services available. However, we typically would, if the individuals was wanting to find a provider in their area, they could go ahead and give us a call, and we will work to help them get connected to a provider in their community. So while we do have the telehealth services available, frequently people will want to see someone in their community, and we absolutely would be happy to help them get connected to services in their community. So again, through that 988 line or through our access line, we would be able to use the system that we have in place to identify providers in their community and give them those numbers so that they could reach out to someone local.
So, sounds good. I believe you mentioned earlier children, so you provide services to all age groups, or kind of what ages do you all typically work with?
Yes, we work with individuals who might be very, very young. So young children that might appear to have some sort of developmental delays. We have a team that works with those individuals to help. Well, frequently, if they're very, very young, it's working with the parents and family members around the individual to help them get the services that they need, get them established, provide the supports, and kind of work with the family as the very young child might get older. And we work with individuals throughout the lifespan. So we also work with people who might be later in life or older adults in providing support to them as well.
What advice would you give to someone who is starting to struggle with their mental health? Kind of what would be your recommendation for the first step?
So I think it's very important when any of us are having some of those thoughts that things are harder than usual. I'm feeling stressed out and not able to bounce back as quickly as usual, to maybe having more significant symptoms where, someone may be having thoughts of wanting to harm themselves or not knowing where to go. First, I want you to know that you're not alone. And secondly, I want you to know that the sooner that you reach out, hopefully we can get you connected to services, whether it's with us or with someone else, to help begin to address those signs or symptoms. That I guess historically there's been a huge amount of stigma around mental health and whether we should reach out. And sometimes there's these thoughts of, well, what would other people think? I think it's very important for people to understand that there is a full line of support available. It just takes someone being brave and making that first call. And, if you're unsure or hesitant at first, if you want to call and just begin to talk, it doesn't commit you to anything, that we will work to try to get you connected to whatever resource might be helpful to you at that point in time. That the symptom that you're feeling doesn't have to always be there, and there is support to help you. And so I know that it's hard, but we have people who can meet you wherever you are in that process, and we'll be here if you aren't quite ready today and want to take that step tomorrow. We'll still be here, and just want you to know that you're not alone.
That's great. Similar question, but any advice for family members or friends or coworkers, who may be noticing signs or symptoms of someone struggling? What advice would you recommend to those individuals?
That can be so hard when we see someone that we care deeply about in pain or having some difficulty in bouncing back like they normally have. So I think being available, being that ear to listen, sometimes then being able to talk about where someone could go that could maybe have someone who is equipped to handle some of the things that they may want to talk about, and a safe, supportive environment to provide that ear to listen to help get them connected to the resources that they may need. We also have a prevention branch here at 7 County Services where we do different educational topics out in the community, and one of those is called QPR. So much like CPR, where individuals are trained if someone is in cardiac arrest to provide support in that way, QPR is question, persuade, and refer. And if someone's having a behavioral health crisis, it's always helpful to know what to do when someone says things that we aren't sure that we're equipped to handle. So the workshop is just very brief. It's only like 90 minutes to 2 hours long. But what they do is they teach you the phrases or the words to use, because really, being open to listening, being open to getting someone connected to the next step is what needs to likely happen. But that can be very intimidating or scary if you are worried about the person and not sure that you're going to say the right thing. So we spend time helping you be equipped so that no matter the setting, whether it's something that happens at work or at home or out in the community, that you would feel more confident in the phrases that you choose to use in order to suggest to the person that you're there for them, that you want to provide support, and you want to be sure that they're safe. So how do we get them connected to the next step? And again, we make sure that you would know the numbers to call, whether it's the 988 or the access line. And I'll go ahead and repeat that again, of the 502-589-1100, to where you can then have them talk with the person on the line. And there's no commitment. It doesn't mean that you have to go to services at 7 counties. It just means that it's someone who understands the process, understands the system, and can get you connected to the services that you need.
That's great. These workshops that you mentioned, where would we find information on how to access those?
So again, good question. We have information about it on our website, which is at www.7counties, spelled out, so sevencounties.org, O-R-G. And you can go to the website, find out about the QPR classes, which again stands for question, persuade, and refer. Or you can call our access line and we can get you to the prevention team, or have the prevention team give you a call back and let you know about the next time we'll have one available in the community.
Okay, thank you. And this kind of ties into that, but I'm assuming the website and the phone line are the best way to get in touch with you all and to learn more. But is there anything else that you wanted to share with us today about the services or other ways to get in touch with you all?
So I think that we've hit the high points of that today. And again, I just want to express that there is no wrong door. It'd be great if you called the crisis line or 988. You don't have to be at a critical point to call 988. That's individuals who are trained in crisis in the community, but they also are available if you just need someone to talk to help you get connected to the resources that may be available. And I think also letting people know that we're here. We're here 24 hours a day, 7 days a week, 365 days a year. And, if you are having feelings of being overwhelmed or need to know where to go in the community, that's what we're here for. It doesn't obligate you to anything, commit you to anything. It doesn't mean you even have to come to 7 counties. We just want to make sure that you're safe and that you are taken care of. So we are here. That's our job. We are what's considered the safety net provider for our community. And that means that we're here whenever you need us, and that we hope that you get the care that you need wherever that may be.
All right. Well, thank you so much for being on with me today. Thank you for answering these questions and sharing the information. I know this will be really good information for our Lions clubs kind of across the state, our members. We have a following from throughout Kentucky, but it's still good to know that, even if people are not in the 7 counties area, you've given them information where they can reach out to you all to find someone in their area if they need it.
Well, and thank you, Jennifer, for reaching out and giving me the time to talk with you all today. I know that the Lions Club does such amazing work in the community and provides so much support for people in our community. And I think that is very closely aligned with what we do in terms of being the community mental health center. So I'm glad that we had the chance to share information today. And if we can ever assist you all in any way, please let us know how.
Okay, that sounds great. Again, thank you for being here, and we look forward to seeing everyone at our next Ask the Expert interview series. Hope everyone has a good evening.
Take care.